Good evening, everyone.
Hello, good evening.
Good evening, Doctor. We'll start
Hello,
shortly as
everyone.
some of the people are yet
Am
to
I
join.
audible? Sure,
Yes,
sure.
Doctor.
Yeah, sure. We will wait. Is my audio okay?
Yeah, audio is fine.
Hello, Dr. Sandeep.
Hi, how are you? Good evening.
So we have 60 as of now. How many registrations do we have? Maybe we'll wait for another 5 minutes and then start off.
On a mission to become leaders in the healthcare, the Global Healthcare Academy was conceived of a vision to standardize high-quality education across the healthcare ecosystem with advanced medical and allied healthcare courses. On a mission to become leaders in the healthcare education space, GHA carefully assessed and implemented core factors that drive high-quality education. GHA developed a dynamic pedagogy to transform the learning experience. Hands-on learning that is practical and applicable to the real world will bridge the gap between industry and academia. As part of this pedagogical vision, the course curriculum is constantly revised and updated to adapt to contemporary times. This instructional approach is complemented by excellent educators. GHA teachers are industry experts who bring their own experience for real-time teaching inputs. The Global Healthcare Academy is founded on a core desire to see a transformative impact on the entire healthcare landscape. The healthcare industry offers boundless potential for a prolific career, yet this potential is far from being realized as the industry battles misconceptions. The opportunities in reality are that there are 14.5 million healthcare professionals needed in India. As a profession, it is recession-proof and comes with hefty salary packages, rich experiences, and even overseas locations. With formalized high-quality education, charting the pathway into the field, it becomes possible to change perceptions and indeed even change the trajectories of individual lives who go on to become a significant part of a larger healthcare ecosystem.
In today's non-stop
और 5 तो बच्चे हैं। ये वाली प्लेट निकाल लो। थोड़ा सा प्याज भी काट लेना सैलेड का। ऐसे कितना मार ली।
Hi, maybe we can just start off. GHA can start its introduction, and then let me introduce Dr. Sandeep later. So who do we have from GHA? You could just start off the session, please. We have about 90 participants. We have waited about 6 minutes.
Good evening, everyone. I'm Harini from Global Healthcare Academy. Delighted to welcome you all for today's webinar on Botox and fillers for facial rejuvenation. Now, let me introduce Global Healthcare Academy to you, your trusted partner in healthcare education. As India's first medical edtech academy, our mission is to develop skilled and compassionate professionals to meet healthcare sector's evolving needs. We harness the power of technology to enhance every aspect of learning through our 5 academic verticals, namely allied healthcare, continuing medical education, Global Dental Academy, Global Healthcare Publishing, and GHA Conference. Now, I would like to introduce our academic director, Dr. Jayashree Bhatt. Dr. Jayashree Bhatt is a renowned ophthalmologist with over 20 years of clinical experience, and she is our course director for our Ophthalm vertical. Let's warmly welcome Dr. Jayashree as she takes us forward in today's session. Over to you, Doctor.
Hi, everybody. Thank you, Harini, for that introduction. But I do not want to confuse everybody here. I am by profession, my core competency is being an ophthalmologist. However, I also take a lot of interest in some specialties like cosmetology, dermatology, and plastic surgery. And some of these courses through DHA, I am supporting them to, conduct these courses. And I'm very glad to have with us today one very eminent dermatologist and cosmetologist, a very good friend of mine, Dr. Sandeep Babbar. And Dr. Babbar, hello. So
You're audible,
we
Jayashree, you're audible.
have
You're audible, you're audible.
Dr. Babbar's second session today. If the first one you guys have missed, then you should go up on YouTube and some basics of Botox and fillers. But before I head I leave the stage to him. Let me have the pleasure of introducing him to you all. Dr. Sandeep Babbar, he is an expert in dermatology and aesthetic medicine. He is the fellow of American Academy of Aesthetic Medicine.
कौन सा है क्या बोल
I'm sorry, guys. Am I audible now? Am I audible, team? Give me a heads up. Okay. So without causing further interruptions, or I want to complete the introduction before I'm interrupted again. Dr. Babbar has over a decade of experience and strong commitment to patient care, and he has revolutionized the field of anti-aging treatments. And I'm so happy and so glad to be here, to have him here with us today. And he will be speaking to us about Botox and fillers, the a very popular subject in today's times, very well catching on. He will cover some basics, which is more of an introduction to his upcoming courses, which we are all looking 2025. Over to you, Dr. Sandeep. Please take over.
Thank you, Jayashree, for a lovely introduction. And good evening, everyone. And thank you for joining. And I'll just make this topic very crisp. And this was like a warm up with Botox and fillers. So well done, GHA team. You've made a great presentation. Just you can add my Instagram ID also. You've added my clinic's ID. I just saw you can add my Instagram ID also. So can we have the presentation, Harini?
Yes, doctor.
From the first slide. Okay. So why do we need Botox and fillers? Why do we need, what is the need of having Botox and fillers? So what are the goals for facial rejuvenation? Nowadays, everyone, they come to a clinic. Some patients are very specific with what they want, but some of them, they don't know what they want. So nowadays, being a doctor, being a good injector is not, the end of it. You should know what is beauty. You should know how to enhance the looks of a patient. How you can do little bit, and those little things that you can do on the face to enhance, to give them a good complete facial rejuvenation. So obviously, wrinkle reduction is something that people, you can see forehead lines, crow's feet, frown lines. Volume restoration, depending what age group the patient is coming, mid-30s, 40s, 50s. So volume restoration is something that you will see on the cheeks, lips, temples, under eyes, tear troughs. Symmetry is something that is very important, but no face is symmetrical. One half of the face will always be different from the other half of the face. You see any face, no face will be symmetrical. So that symmetry is not something that we cannot bring it to 100%. That's how you have to counsel your patient. And boosting self-confidence. Obviously, how you can nowadays, in the era of social media, everyone wants to look good. Looking good is now a necessity for professionals and even doctors and even sportsmen. In every profession, they want to look the best of them, especially thanks to Instagram. So next slide. Let's start with facial anatomy. I will keep this session. I don't know what you guys are practicing. How are you doing Botox? You're not doing Botox, or you want to do Botox. So this is just like a warm up. So just basics is what we will discuss here. And if you like, and then you can enroll for their, further lectures. So skin layers, we all know: epidermis, dermis, subcutaneous. Fat pads, we should be very thorough with the fat pads of the face, because how you can give minimum product in the fat pads and get maximum output from your injections. Bone structure is very important. Some injections have to be on the periosteum, which for the pillaring of the filler. So bone structure you should know very well. And muscles for Botox is very important. So frontalis, obliquus, oris, corrugators, procerus, masseters, platysma. Though we are for these are some of them are off label. Only the procerus and the corrugators have been approved for some indications, but we do a lot of off-label in injections also. Next slide. So for starting with Botox, see, for Botox you should be thorough with your anatomy. So muscles is something. Facials muscle behave in a very funny way. They are not like normal muscles. They are attached into the skin, so they're hanging. So their depth is very important, and at which level, what depth are they present, and how deep they are. Because Botox is something that is not forgiving. Fillers are still forgiving a little bit, but Botox is something, if you're in the wrong plane, in the wrong muscle, then it's not forgiving. You have to hold hands with the patient for 3 months. There is no antidote as such. There are some antidotes, papers are available, but they don't really work. So first, be thorough with your anatomy. So upper face is something that is easier to start with, and you can start doing your upper face easily. So starting with procerus is something you do procerus in the upper face. this muscle is procerus. Then, corrugators, supercilii with the body and the tail. Frontalis is where you inject. It's comparatively a superficial muscle. And orbicularis oris. These are the muscles of the upper face that you should know where to inject, how to inject. Supracerus is a slightly a deeper injection. Then corrugators almost a second bevel deep. Tail is slightly superficial. Uh, in India, the anatomy of a lot of patients is different. So you should mark the patient according. You should make all the expressions for the patient. You should make them frown, make them smile, make them startled, and then you should mark all these muscle accordingly. And nowadays there is there are new papers that show that frontalis and the corrugators, and they have a line of convergence here somewhere in the between. So you always inject in the part of the frontalis which is on the upper side of frontalis. Don't inject in the lower side of the frontalis, because that will cause further depression of the eyebrows. People in India, they want bigger eyes. They want bigger and fuller eyes. So you want to inject on the upper side of the frontalis. So marking is very important. Once the patient comes, you should know how to mark. You should know the anatomy. That is very important. I hope my voice is audible.
Yes, doctor.
In
Yes,
between, if
perfectly
there are any
all right.
questions, you can just post it and then we can take it at the end.
Sure.
Yeah. And if you want something to be discussed, you can pop up a message and the GHA team can tell me, and then we can answer it, or maybe at the end of it, howsoever. Okay. And if you want me to go slow, we can go little. Like, I got a message. Thank you. I'll go slow. Don't worry. Thank you. So I'll repeat the anatomy. So frontalis is a muscle. This is the. Can you GHA team? Can you just make the cursor? And because I won't be able to do it, you have the frontalis on the forehead. Can you see the muscle frontalis? It's a V-shaped muscle. In some people, this V is not as deep as it's shown in this diagram. So when you ask a patient, just give them a startled, like, just see my startled look. So you can see the frontalis. The work of the frontalis is to lift the eyebrows. Okay. And procerus and corrugators. This is procerus and this is the corrugator. Okay. Don't see all the muscles, just see the muscles of the forehead. So procerus and corrugators basically bring the eye, they make the eyes widen. That's the function. Okay. And orbicularis oris is a circular, very superficial muscle around the eye, where it is basically to open the eye. Okay, so you have to be very superficial in orbicularis oris when you are injecting. Okay, am I clear? Is the anatomy okay? Let's have the next slide, please. So anatomy is very important. Like I said, fillers, you can still, though fillers have very fatal complications also, but fillers is something, if you're on, it's a little forgiving. Botox, if you're on the wrong plane, you're on the wrong muscle, it is not forgiving. There were some other muscles also in the previous picture, but we are not discussing, we are not going into the, we are only discussing basics of Botox and basics of, those muscles comes in the advancement. Once you are thorough with the basic, then we can discuss those muscles, how we can target those muscles with Botox. So right now, just it's going to be a warm up. You should know all this, and then we can, maybe talk about if we can take in depth for upper face Botox in the next course. Okay. So understanding facial anatomy helps to avoid complications, a nerve damage and vascular, especially in fillers. So effective and precise injection landmarks techniques is very important based on the anatomy to ensure safe and optimal results and long-lasting effects. Because Botox is something, it also has a property to spread. The injection, when you're injecting it, has to be very slow, and it should not, if you put it very fast, it can penetrate through, and because the muscles are not very deep, it can penetrate to the other muscles, and then it can cause complications. So the precise injection, landmarks, technique based on anatomy ensure safe, optimal results and long-lasting effects. Risk of poor placement. If you are injecting in the corrugators and by chance you go in the palpable part of the orbicularis oculi, you can cause drooping eyelids. If you are in the wrong plane with a filler and you are go into a artery or a vein, artery or on any vascular, you can cause a vascular occlusion, and asymmetry can also happen. So aesthetic practice seems very easy, but it's not very easy. You have to be thorough with anatomy, thorough with the product knowledge, thorough with with the plane of injection, and then only you can be a master of it. Okay, next slide please. I hope the speed now is fine. Okay, age related changes, so volume loss. First of all, whenever a patient comes to you, always you see for volume loss. Volume loss starts from the upper face, see from the temples. Then you can go on the under ITR troughs, see the cheeks. Okay, see there will be volume loss on the nasolabial folds. There will be volume loss on the chin. There will be volume loss on the cheek area, buccinators. There will be volume loss on the lips. So this is something that you should tell the patient, because see, patients come and say कि मेरा glow खत्म हो गया, my glow has gone. So you should understand all the concave spaces will always absorb light, and that's why there will be dullness. All the convex spaces will reflect light, and that's what glow is. When your face is reflecting light, like just imagine a ball of Nike ball football in the Nike store. It's always kept under the light, and it's always just emitting light. It's like glowing. So that's a properly convex space. Similarly, if you have any concavities like under tear troughs, or these will be like this. These are seen like shadows or pigmentation, but they are basically volume loss. So you need to address, and you should have this approach of understanding what is volume loss. Second comes on wrinkles. Skin elasticity decreases, causing wrinkles. People are having the lives become, it's a stressful life now. Sleep patterns are not there. People are not drinking enough water, too much alcohol, too much partying, smoking, not having a good diet, not using a sunblock, not using a retinol. So wrinkling process is just aging has become a little faster now. And sagging. So I don't know about. I practice in North India, so sagging, people here are little. Sagging is a very big issue here. People are a little heavy. Their diet is such, and especially middle, some people who are a little overweight, they have a lot of sagging. And sagging is something that is very difficult to treat. Even with filler, you cannot. You can open 10 syringes and you can't fix sagging. So sagging is something that has to be addressed initially. People now come, people are coming at fifth decade of their lives and they want suddenly with one procedure, they want full result. That is not going to happen. Okay, so sagging, we'll take it for another lecture. That's for threads. Next slide, please. So this is a global assessment score. You can Google it. So this will make your aesthetic practice very easy. So you can, just there are marking there where it says 1, 2, 3, 4, 5. So if a patient comes to you, you can first see the skin texture and assess the skin condition, including wrinkles, fine lines, pigmentation, elasticity, superficial skin, and score it to 1, 2, 3, 4, 5 according to you. Then comes facial volume. Observe the presence of sunken cheeks, hollow eyes, and loss of definition of the face. And then you grade it according to 1 to 5 according to you. Facial symmetry is something you see, compare. If there is slight asymmetry, it's fine. Don't go after it and try to fix it. People will come to you and they will say, it will be hardly any difference, but don't go for it. If there is a major asymmetry, then you can fix it. Minor asymmetry, it's fine. Don't fix it. Next slide, please. So facial 1/3. So upper 1/3 of the face, forehead to brow, middle 1/3 of the face, from cheeks to nose, and lower lip, jawline, and chin. If these three thirds are in equal proportion, you will see you are basically, there is a good, that's a good filled up face. So he doesn't need a lot of, rejuvenation. And patient goals, patient goals, it's not easy to please aesthetic patients. You should understand if the patient is having, unrealistic expectations. We are doing minimally invasive procedures. We are not plastic surgeons that will be changing the whole face. So we have to sit down, and you have to, you should have a series of your before afters, and you should show them, this is how it was and this is how it looks now. So this is the kind of improvement you should expect. If you don't have before after pictures, then just, from internet, show them something that, you think you will be able to achieve, because you're starting your practice. I don't know, like, have you started, you haven't started, so then you can take pictures from the internet. Am I clear? Is everything going okay? Next slide.
Yes, sir.
So facial symmetry, as I told you, importance of balancing. See, before, why am I focusing on this? Because before putting Botox, okay, you know the anatomy, you know where to put it, everything is fine. But you should know how, what the facial symmetry, does he even need it? Does it even require? So all this is very important. A symmetrical face appears more aesthetically pleasing, definitely. Symmetry is achieved through the proper placement of injections. Measurement tools, you can use grids, photographs, calipers, rulers, and that will give you ensure accurate symmetrical injections. Adjustment as needed. Slight adjustment may be necessary to create a balanced and aesthetically pleasing outcome. Okay, next slide. Okay, I just missed one point on the previous slide. Can you go back? So yeah, I also use a ruler where I go with the, all the thirds of the face. Also, there is a beauty ratio. I don't know if you heard about it. It says anything in a proportion of 1:1.6 is beautiful. Why that Hollywood actress is looking beautiful? Because all her features are in a proportion as to 1:1.6. Though this beauty ratio does not apply to us Indians. For Indians, it has to be 1:1 ratio. That will only be appealing or, aesthetically sound for us. Am I clear? Okay, next slide. So Botox is like a, we using term Botox is like it's a brand. It's a brand owned by some company. The usual word is botulinum toxin. But we cannot tell our patient, okay, we'll be injecting botulinum toxin to you because you want to paralyze your muscle. Don't say that. Say that we will just relax your muscle, and we'll use what we can use. You call it Botox or anything, or neuromodulator or anything like that. So we'll just relax your muscle. Botox is like a brand name. It goes to a company. Botulinum toxin is what the salt is, like what it really is. So it basically paralyzes the muscle. Don't tell your patient we'll paralyze your muscle, and they'll never come back to you. They'll be like, "यार doctor क्या कर रहा है यार, paralyze कर देगा ये तो पूरा." So for forehead and for crow's feet, it's for forehead it has been approved, but there are also a lot of off-label uses that we do that we'll discuss later. And derma fillers are injectable. They are permanent or semi-permanent fillers that we do for giving more volume, more hydration, more collagen production for your face. So yeah, next slide. So what is botulinum toxin? It is basically Clostridium botulinum toxin, and it's a dangerous thing. It is what causes your exosomes. Okay, Dr. Sushila, we'll come to exosomes. So it in 1978, if I'm not wrong, or 1980s is when botulinum toxin was introduced for strabismus. So there was a couple, I am forgetting the name. There was the female wife was an ophthalmologist, and the husband was a dermatologist. So the wife, the ophthalmologist, they were using botulinum toxin for strabismus, and they found out that in whoever they were injecting botulinum toxin, suddenly the wrinkles were going. And that's how it was a serendipity. And then in 1980, it was that dermatologist started, working with the company called Allergan. And that's how, botulinum toxin and Botox came. And from there, it started. In India, though it came in mid 90s or maybe later, but some people had started doing in India for in early 90s also. Okay, next slide. Mechanism of action. So botulinum toxin is as a simple mechanism of action. It goes at the neuromuscular junction, where the exocytosis of acetylcholine is happening. There is a protein called SNAP25. The botulinum toxin gets attached to the SNAP25 protein, and then it basically it stops the exocytosis of acetylcholine. Inhibition of acetylcholine release happens, and that blocks the neuromuscular junction, and thus causes a temporary relaxation or paralysis for 3 to 6 months, depending how much unit of Botox we are using, how we are injecting, which product we are using, and how the body is metabolizing the toxin. So the results are variable. It's from 3 to 6 months. Some people last for 6 months. Some people finish it in 3 months. Okay. Next slide, please. Types of Botox. Okay, this is too intense. This is not something that you should know. Oh, you should not worry. Okay, these are the type A, B, C, D, E, F, G. Okay, you don't need to know all this. Type A Botox is what we are using. The commercially available, and for aesthetic purposes is what we are using type A. Now type A also has a lot many types, because for example, like a companies promoting a ciprofloxacin brand, it will be different for every company. Similarly, botulinum toxin is being marketed by different companies. Botox, Dysport, Xeomin, and now an Indian brand has also come up, Stanox. It's also type A Botox. So you should just know that type A is what we use in aesthetic purposes. Next slide, please. So these are the popular brands that we use: Botox, Dysport, Xeomin, and nowadays Stanox is a new Indian brand, and it's a very promising drug. Very promising. We should promote Make in India. Which brand of botulinum toxin? Sorry, there's a question. Gives long-lasting results. So long-lasting results depends on lot many things than just brands. Okay, so if you see these brands, if you go in details, you will see that the density of botulinum toxin is different in every brand. Dysport having the maximum density of it. Also, uh, how you are putting it, like if you which muscle you are putting it, how much units are you putting. If you're putting too less, it will be metabolized too fast. So we have to have a plan. We have to see the activity of the muscle. Once you keep injecting a patient, you know which muscle, how it absorbs, how much muscle. You have to titrate the dose of Botox. Thus, Dysport has a very good, like some people say that Dysport has 10-15% more longevity. I'm not supporting Dysport. I don't use Dysport that much. I use Stanox, Botox. Sometimes I use Dysport. But, there is not a lot of difference in the longevity. I think longevity comes with, repetitive injections. If patients are regular, when you are injecting in the right plane, with the right speed, and that's also a big factor which improves the longevity of the injection. Next slide, please. Application and techniques. So Botox can treat wrinkles caused by muscle movements such as forehead, frown lines, and crow's feet. Injection techniques vary depending on the area being targeted, and precise placement is very crucial. We've already discussed this, so we can come to the next slide. So we have another question. Does the Botox cause permanent paralysis of nerve? No, boss. ऐसा होगा तो फिर हमारे सबके clinics बंद हो जाएंगे. So no, it doesn't cause. I don't. Has any patient asked you this question? Okay. So onset and duration. So if onset takes almost 5 to 7 days, and a full results comes in, I would say not even 2 weeks, it takes 3 weeks. And depending on the metabolism of the muscle, like if you are hyperthyroid, if you have any autoimmune disorder, or if you are diabetic, more glycation of the tissue, then your botulinum toxin will be metabolized at a faster rate. But if if you're injecting in the right plane, at the right speed, at the right formula, with the right formulation, right product, then all these things, you can increase the duration of your Botox. Also, if the patient, they have a good regime, using retinol, helps not immediately, after obviously after 2 weeks of your Botox. So using retinol, good moisturizer, good sunblock, that also improves your wrinkling process. You should have a good regime also with this. That also helps in longevity of Botox. Okay, next slide. There is a question that no, you cannot use Botox in pregnancy. It's a contraindicated in pregnancy. So dilution and preparation, normally you get 50 unit or 100 unit. Okay, in Dysport you get around 120 units. So, but mostly brands have 100 units. These are absolutely empty vials. You can't see anything. Most of it has happened that some people have just thrown the new Botox vial in the dustbin, saying that it's because hey, but once you inject saline, you on 100 ml and 2.5 ml saline, you can make 100 units. So higher. If you some people are even diluting it with 5 ml or 7 ml, depending, doing micro Botox, and so there are all sort of things in the market. So you have to understand what does the patient want. If you want if you want lifting, and if you want basic paralysing of muscle, then you should go with 2.5. That's a gold standard. Okay, next slide. So this is what the Proceres is. You can see the first picture. The Proceres has been this thing injected, and it's got a good result. So if you inject Botox in the right plane and the right, it's a very good, people's results are very gratifying. Patients are very happy with it. If you become a master of Botox now, people are very happy. To become a master of Botox is easy, but to become a master of filler, there's a long curve. So then patients with Botox, if injected properly, they're very happy. Okay, so then this is the forehead, the frontalis that has been injected, So you have to mark the whole frontalis muscle, and you have to inject equal it's like mathematics. So if you are injecting Botox, you have to just remember it's a tug of war between all the muscles. So the proceres, the corrugators, and the frontalis are pulling each other. So you have to balance it out. If you unbalance it, you will get unbalanced results. Similarly with orbicularis oris. Okay, so it's all about titration. It's all about mathematics. Don't try to go for asymmetrical treatments. First treat all muscle with equal doses. Come call the patient back after 10 days, and then if you still see asymmetry, then try to reach it. Don't try to do mathematics. Iska kam hai to isme 3 unit dal diya, isme 4. You have to do equal units at first. Okay. Next, I had 2 questions. Micro Botox constitution. I told you 5 ml. 5 ml, and shelf life after dilution. This is like a very good question. It's a very controversial question. Any allergen test to be done prior to injection of Botox and fillers? Okay. So after formulation, see, if you are using regularly, it's fine. But I know people who are even using Botox after 4 weeks, and it's fine. There is no problem. Or I know these companies will tell you, you use it in 20 days, otherwise it's not useful. But it's nothing like that. You can use it. I also use it till 2 to 3 weeks. There have been no issues. And if you have a fridge which is not keeping your staff food, and it is not contaminated, then it's only for injectables, then you can keep it even more, because nothing is going to happen. Just it has to be in cold chain. I was my teacher, Dr. Nitin. He was just telling me that there was a case where he there was basically what happened that a doctor was complaining to the company that that if there was a lot of Botox that did not give any results. So what was happening is the staff was formulating the Botox at 2.5 ml, and he was just and doctor was coming late, as we are all getting, all doctors are getting late for the procedures, and it was kept at the room temperature. And India room temperature is variable, 30, 35, 25, it's variable. So at 30 degrees it will just denature, the toxin will be gone, it will not work. So whenever you are formulating Botox, you should keep a cold box under it, an ice box. You should keep it, or keep it in the fridge. Formulate it, keep it in the fridge, and then take it out at the time of injection. Otherwise, it won't work. This is a classical case of crow's feet. You will get a lot of patients who say, "Just do crow's feet, don't do it. It's not rewarding, and it won't give enough results." Always do all the upper face muscle together. Next slide, please. Okay, fillers. We all know what fillers are. Next slide. So we use hyaluronic acid filler, calcium hydroxyapatite, polylactic acid, polymethylene, PMMA acrylate fillers. So I'm using hyaluronic acid. I have done PLLA fillers also, but calcium hydroxyapatite semi-permanent I'm not very fond of. Even PMMA is semi-permanent or permanent I'm not very fond of. So PLLA we will get in India very soon. Hyaluronic acid is everywhere available. A lot of brands coming there. Next slide, please. Mechanism. So hyaluronic acid is a ground substance of your skin. This is hyaluronic acid. You see a kid and you see so many this thing. You feel like just seeing feel like squeezing their cheeks, because that's full of hyaluronic acid. With time it depletes. Stress, smoking, alcohol, sleeping patterns, nutrition, it depletes. So it's a ground substance of your skin. It's a hygroscopic agent. That's why when we inject HS syringes, we tell the patient have a lot of water. Okay. Next slide, please. Calcium hydroxyapatite. It's basically it's a microsphere of CAHA, which when injected multiple times initiates collagen production. It provides structural support and long-term collagen stimulation. Not very popular. Next slide, please. Next slide. Yeah, PLLA is a good filler. There's a good brand called Sculptra, very popular in the West. And no, the previous one. No. PLLA is Sculptra. PMMA filler is another, it's a semi-permanent filler, not very popular. Immediate volume and long-term structural support. We're not looking for that. Hyaluronic acid and PLLA is what we would be more than happy to do. And yeah, next slide, please. So Saifa is the largest producer of Saifa Chroma, Filmed, Juvederm, Resilient, Bolero. Radius is also good, calcium. And Sculptra is a good brand. Belafil, not very popular. So yeah, I'm using Saifa, I'm using Chroma, I'm using Filament, I'm using Juvederm, I'm using Resilient. Bolero also we've used. So yeah, more or less we've used all of them. And Sculptra said not there in the country. Radius is not in there in the country. Belafil, I don't think it will come in India very soon. So next slide, please. We have a few questions. Any allergen test to be done prior injection of Botox fillers? Not really. Not something that we practice. Which syringe or needle to use for injected Botox? Yeah, you can use insulin syringe. You can use a Montux syringe. Those are so in different Botox and fillers that we've discussed. Botox is like for paralyzing muscles. It's for static wrinkles, and fillers is for dynamic wrinkles. Please make a WhatsApp group. Okay. Very informative webinar. Please share recording also. Okay. Any different treating men and women with Botox? Dilution will be the same. Yeah, dilution will be the same. So men is something, men, you don't have to overtreat men. You have to give them that manly look. You have to give them those, like in that patient, there was a picture you saw him. So, like Brad Pitt, he has a little bit of crow's feet. He looks manly with that. Don't make him, very plasticky. Let him have little wrinkles. Men look better with wrinkles. Females obviously don't like wrinkles. So just knock it off. However they want it. They want a subtle look, but always go with less. Less is more. Always do less. Call the patient back and then do more. Okay, face uses of filler, cheek, temple, jawline, we've discussed. Nasolabial, marionette line, perioral line, we've discussed. Lip enhancement, okay, we have discussed. Under eye reduce, under eye dark circles, as I told you, concave space, inject, become convex, becomes, dark space becomes glowy. Non-surgical rhinoplasty, not a very good idea, very, very risky. It's advanced level. Don't go for it. Refer to plastic surgeon. Chin, jawline contouring. Okay, very good, very good. High G prime product injected with that. Hand rejuvenation, yes, very good. You can use it for hand rejuvenation. Mid 50s, mid 60s patient. Next slide, please. Okay, we've discussed this. Hyaluronic acid, we've brought duration, it lasts up to 6 to 18 months, 12 to 18 months, 1 to 2 years, 5 years or more. So not looking for 5. We want the patient to keep coming back again and again. We don't want them. So hyaluronic acid is the best. I would say 10 to 12 months, not 6 to 18. People complain, the companies claim a lot of many things, but I would say 10 months, maximum 12 months, not more than that. Okay, next slide, please. Hyaluronic acid fillers, okay, dilution preparation. So we in India we get pre-filled fillers. We don't need to get the vials of hyaluronic acid. So it's all pre-filled. It's 10% lignocaine and 90% is hyaluronic acid, depending on the cross-linking, what kind of softer material, harder material, or medium density material, depending upon the G prime of the product. So G prime is something that you can look up to. You can read about it. What is G prime? Okay, and radius is something that is not in the country. We should not discuss it. Next slide, please. Next slide. Am I audible? Yeah. Next slide. So PLLA is also good. It's a mix with sterile water and then injected. It needs multiple injections. Not there in the country till now. Next slide. So types we have discussed, uses we have discussed, techniques is what we should know, what has to be on periosteum, what has to be on the bone, what has to be in the dermis, what has to be in the subdermis, So we have to know the anatomy, we have to know the ligaments, we have to know the fat pads, and then we can discuss techniques. And maybe for the future advanced courses. Next slide. Lips, lips is something that is becoming a fad these days, So depending on the profession of the person, they want bigger, lesser, subtle looks, depending on the profile of the person. And this is for cheek augmentation. OG curve is what we're looking for. You see all the Bollywood actors, they will have a full cheek starting from the mid cheek to the cheekbone. This is what a full cheek is like. Top model look. This is what is top model look. You see Deepika's picture, you see Alia's picture, you see any actress's picture, and they'll have a top model look. Next slide, please. Next slide. Harini, are you there?
While she's at changing the slides, Dr. Sandeep, if you can just look at answering 1 or 2 questions from the chat box.
There are too many questions.
Yeah, there are a lot. Let me just come in here and just say that, this purpose of this webinar is, it's not like an instruction course. The purpose of the webinar is to get a collective group of people who are interested in this subject and introduce them to our specialist here. And Dr. Sandeep has amazing courses lined up for the coming year. So you all can be in touch with us and GHA will be able to tell you based on the the level of practice of the present people. Like, because if it is dentist, then there is another vertical for that, and Dr. Sandeep would be teaching people who are dermatologists and plastic surgeons. So we have categorized like that because of some regulatory issues and considerations rather. So then all these making WhatsApps groups, etc., would be at that level. So now, if Dr. Sandeep can just take up one or two questions from the audience, then
Yeah,
it would.
yes. Okay. Yes, please share medicine, please. Okay. Post-operative post-operative instructions for these patients. No facial massage, no steam sauna, no makeup, no face wash for 4 days, 3 days, no rigorous exercise, not sleeping on the face, and yeah, that's about it. No sudden jerky movements. Yeah. Dose of Botox depends on how deep the muscle is, how big is the muscle, how thick is the muscle, how active is the muscle. Botox for good for pit scars. Yeah, there are some papers coming up. So that what was for micro Botox, open pores. And people are doing it, but we have so many other modalities. Why do you want to risk yourself if you are in a different plane? Also discuss about Spock bros. So there are newer techniques to Hurling core. So there are newer techniques to inject now. You don't need the anti-Spock. You take the marking from the lateral limbal line. You don't need the anti-Spock. This was a primitive. This was a very old style of injecting. Nowadays, you inject in a way, W pattern that you don't need the anti-Spock. Okay, I think more or less I've covered all the questions. Dilutions are the same, 50 unit, 100 unit, same dilution. So yeah, myomodulation is what combining Botox and filler. You can do it on the same day or do Botox first and then do fillers, or depending, give a good look. Next slide. I think we're running at the end of the webinar now. These are our upcoming courses, and we are doing a very advanced training in collaboration with GHA in Bombay. It's going to be an offline course with top injectors of India, and the course will be for MBBS, dermatologists, and plastic surgeons. And there will be a cadaveric dissection, and there will be hands-on training, and we'll discuss the theory part also, plus about how to market your brand and how to market your then we'll have lectures on the commercial side of being a demopreneur, or being a entrepreneur with your practice. So we will discuss all of that in our course in I think it will be in end of April. So that you can, with GHA, you can plan to attend. It will be basically bringing or injecting, game to a next level. So that will be one of a kind in India. So I would suggest you should add that, and we'll keep having these webinars on and off. Yeah, I think that's it. And thank you all. Thank you, GHA. Thank you, Dr. Jayashree. Thank you, Harini, for making a lovely slide, lovely presentation. Yeah, and yeah, that's it.
Thank you, everybody, for having participated. Can GHA put down the links where they can be in touch, contact numbers of GHA, so that for the upcoming courses, whoever is interested, I see a lot of interested people in the webinar today. So based on the category, whether you are a nurse, whether you are a dentist, or whether you are
M pattern. I'm sorry.
So we do have courses designed as per your requirement. So then we will keep in touch with you. You can keep in touch with us on the numbers that we are going to provide you. Thank you, Dr. Sandeep, again for sparing time from your busy schedule for us.
No,
So,
thank
and
you.
we look forward to 2025 and all the courses that you're going to be conducting for us. Wish you very new year, happy new year in
Happy
advance,
New Year.
and thanks
To
to all the
everyone.
participants. Wish everybody a very happy new year in advance as well.
Dr. Sushila, we'll have a course on exosomes. You can, you can ask GHA. We'll talk about exosomes in detail. That because it's almost been an hour. People must be sleeping by now. Thank you so much. Thank you.
Thank you, Doctor, for sharing your valuable insights with us today.
Yeah.
I
Thank
would like to thank everyone who attended and made this webinar a success. We hope you find this session informative and beneficial. Looking forward to see you at our future events. Thank you.
Thank you. Thank you so much.